This video is for people wondering why their feet hurt. Now, I'm a reflexology therapist, and in the foot, there are reflexes that map to every part, gland, and organ of the body. Now, when your feet hurt, it could be because of something physical, like if you sprained your foot, that's obviously local. But sometimes when there's an imbalance in the body, the reflexes get tender, and they're clear indicators of what might be going on in other parts that is trying to pay attention to. So when your reflexes in the toes hurt, that's usually mapped to things going on in the head, right? So if you got a headache, if you got sinus issues, if your teeth hurt, all of those things are things that reflexology therapists work on with the toes. Now, in this area of the foot, we've got the shoulder reflex, we've got neck and shoulders. So if you got poor posture, or if you are stressed out, or if you do a lot of desk work, anything that puts tension on the shoulders, we find it as reflexology therapists in here. Your shoulder is in here. When you're looking cardio side of things, so anything to do with the heart circulation, it's all in here. And it's interesting because the body actually stores emotion too. I actually developed emotional reflexology. But when the heart reflex is tender, it could just be because of something that's stressing you out. People that are heartbroken due to loss or grief, anyone that's kind of depressed, their heart reflex is tender. So again, somebody that walks like this, physically, this area could hurt because of the added pressure, especially people wearing high heels all the time. Everything kind of gets pushed. Physically, it could be that. But if you've got poor circulation, it could be sore because of body system having stress, or if it's emotional, it can be that too. So that's why reflexology therapists never diagnose, because anywhere that your feet hurt, it can be because of so many different reasons. Is it physical? Is it emotional? Is it nutritional? Is it mental? Like it could be anything. But if not a physical thing, then reflexology can help guide you to find the imbalance maybe in other areas of your life. So in this area, it's more the lung reflex, right? So in here is the breathing side of things. It could be a physical thing. It could be you're just shallow breathing because you're stressed out. It could be allergies, anything. Anything to do with the air is in here. Now, the diaphragm is around in here. Again, it's common for shallow breathers to experience some tenderness when a reflexology therapist works this area. And if you look at this spot right here, that's called the solar plexus. Now, the solar plexus especially gets super sore when you're under a tremendous amount of pressure. The solar plexus is the reflex that actually controls the autonomic nervous system. Now, the autonomic nervous system is broken down into the sympathetic nervous system. You probably know it as fight or flight, and the parasympathetic nervous system, which is rest and repair. In a reflexology session, the goal is to actually take a client out of the sympathetic, the fight and flight, put them into parasympathetic, which is rest and repair. Make sense? Now, in here is the liver reflex. The liver has 600 functions. It's a pretty busy organ, and it's common for it to be tender. Now, it could be tender because, again, there might be something physical going on in this area of the foot, but it could actually also be because you ate something. Did you go drinking last night? Like it could be anything that is causing that. A lot of times, if you eat corn, you go to a barbecue, have corn on the cob. Corn is really hard for the body to digest, and it causes extra tension in here. So maybe it has to do with that. Now you know why we don't diagnose, right? In here is the stomach area. So if you have tension in your stomach area, this is where your foot could kind of get sore. In this area right here is the small intestine. When you're looking up here, this is the kidney. The bladder is over in here. And then we go down to the pelvic area. Now, if you're getting out of bed in the morning and it's hurting a lot right in here and you've been diagnosed with plantar fasciitis, I'll do another video talking about that. And I will link it below. But a lot of times when people they have pain right kind of in here, it's because on the entire base of the foot, there's a tiny layer called fascia. And sometimes the fascia gets some tears in it. And when you have tears, I want you to think about if you get a cut and it starts to scab over. Well, if you were to take that cut and tear it open, it's going to hurt, right? Well, same thing happened. A lot of people that have plantar fasciitis, it's super sore when you get out of bed in the morning because the fascia has got a little tear in it. And when you're moving, it stays kind of stretchy, right? But when you let it sit for long periods of time, it scabs over. Well, what do you think happens when it's got a fresh scab on it and you go and you put all your weight first thing in the morning? It tears again, right? So if you have plantar fasciitis, a lot of times it's because this calf muscle is really tight and it's pulling. So imagine the tension from your calf is pulling the fascia, and then it's got a tear in it, and then you ram it down into the floor first thing when you get out of bed. Not the best idea, but you don't know what you don't know. And so, I mean, how do you fix it? Well, the very first thing I strongly recommend is, if this is going on for you, stretch your feet first thing in the morning. So don't get out of bed. Just when you wake up, make sure to flex the muscles, work the calf to loosen this up, rotate the foot both directions, right? And then when things feel loose, put a little pressure, see if it's worked out. If it's not worked out, keep on stretching it until you can stand up without wanting to scream, okay? That's what I recommend. And then after you're done that, I recommend taking like a little water bottle and putting it in the freezer and just ice and roll the foot on ice. You can put a towel on it. You don't want to have direct ice on your foot, but I recommend rolling it like that just to kind of soothe it a bit, and then you can go on with your day. I got off on a tangent there, but right in here is the pelvic area, and then along the side of the foot is the spine. So in the spine, it's neat. There's actually 26 vertebrae in your back, and there's 26 reflexes in your foot too. And so for people with lower back pain, it's going to hurt more in here. Middle, like your thoracic spine is more in here, and cervical spine is here. Arm and leg are on this side of the foot. And then on the dorsal side, you've got your chest and lung, the jaw, teeth are at the base of the toes. And then there's a knee, thigh, hip area in here that gets really tender if you got those kinds of issues. And then of course there's our immune system that's kind of scattered throughout the entire foot, depending on what's going on. So if you're wondering why your feet are sore, I hope that gave you some insights and some clues as to where some imbalances may be. And if you have any questions, reach out. It's reflexology@kalindatrifo.com. Pleasure talking to you today. Bye for now.